Do you want to know the best beauty secret under the sun? A hat. Really. Some people still think a suntan looks good, even healthy, but a tan is a sign of skin damage, and that can lead to premature aging or even skin cancer. So keep yourself and your family safe from the sun. Stick to the shade, especially during the midday hours when the sun is strongest, and always use a sunscreen with an SPF of 15 or more. You'll look better and stay healthier.
The hot summer months can be unbearable for many of us, but for expectant mothers and babies, the heat can prove to be a very serious health hazard. On this edition of News Probe, we will talk to some experts about risk factors related to extreme heat conditions. I'm Dr. Brian McDonough, and we'll be right back. Hi, welcome back to News Probe. I'm Dr. Brian McDonough, and today we have a very special program where we're going to be talking about child health issues, in particular, issues with babies and the heat. It's all part of a year-long program that we've devoted to child health called Baby Your Baby. You may have seen some of our segments on the 10 o'clock news and also on News Probe. We have a group of experts with us here to try and help us sort out of a lot of important issues. First of all, Peggy Stemler, who's a physician with the Philadelphia Department of Health, Ann McCartney, who's a nurse midwife, who's going to talk to us a lot about those issues related to deliveries in those early months, and also Tracy Goldstein. Tracy is pregnant, and she is someone who has a lot of first-hand experience that she's going to talk about as well. Why don't we start with you, Dr. Stemler? You're pregnant as well, I might add, and you're looking at this from a unique perspective. Carrying a baby, being a pediatrician, you see both sides. This summer has been incredibly hot. What have you done to try and battle any potential problems with your child?
Well, I have to say I'm fortunate that the heat doesn't bother me too much. It never has. But I've been trying to be really good about drinking lots of liquids, particularly water, and, you know, staying cool, not doing too much outside.
You mentioned the liquids right off the top. Mm-hmm. Is that a real key thing to try and keep hydrating yourself, getting those fluids going?
Well, I think so. It's been very helpful. It's hot out, you sweat a lot. And as a pregnant person, and can talk more about that too, it's very important to stay well hydrated, avoid some complications for pregnancy that way.
Well, Ann and I were surprised to see each other today because we go way back. She was involved in the delivery of my daughter as a nurse midwife, and certainly at that stage there's not a lot you can do except the technical things of helping out with the delivery and providing all the assistance you can. But in those months during pregnancy, there's so many critical aspects, and one of the things we often ignore is taking advantage of proper diet, exercise, and watching the environment. What are some suggestions that you give to patients that you deal with in those early months?
As far as dealing with the heat?
Yeah.
Well, I tried, of course, drinking lots of fluids is real important, but also just trying, of course, to stay cool. Women that are pregnant, their metabolic rate is increased by about 25%, so they're going to feel the heat more. So some of the things I tell my patients is to make sure, if you don't have air conditioning, to use a window fan. If you can get out in the heat of the day, go to an air-conditioned place, go to the movies, go to the mall, go to a public place. A library is a great place to go to get away from the heat. And also, if you're going to do housework or even exercise, do those kind of things that are going to expend energy and make you hotter. Do them in the cooler parts of the day, early in the morning or late in the afternoon or early
Right, take that middle of the day as a time to really rest.
Just to rest and stay out of the heat, basically. Drink lots of fluids again.
Tracy Goldstein's with us. Tracy, how far along are you in your pregnancy?
35 weeks. 35
weeks. You're getting pretty close.
Yeah.
And, you know, everyone always says, oh, the last thing you want to do is deliver a baby in August. I mean, here you are, August going into September. My question for you is, you're now in that situation where you're frustrated, and we've had a lot of heat lately. What are the things that you're doing to try and make it easier for yourself?
Well, I try and keep from outside, because once you go outside and you come back in, your body gets hotter. And I try to take a bath during the daytime, because that cools you off. And drink a lot of liquids, and I try to drink water and juices, because sodas and those type of drinks, they just seem to make you hotter. When you drink water, it cools you off, And as far as cooking, try to eat sandwiches instead of cooking because the heat from that makes the house even hotter. So, and stay behind a fan or...
A lot of really first-hand information where you've seen things happen and you said, I'm not going to do this again tomorrow. I'm going to make sure Dr. Stemler, what about, we're talking a little bit about heat and those issues. What about trying to incorporate exercise, which is very important in pregnancy, into this type of setting where it's so hot outside?
Well, I think exercise is really important, and as Ann said, try to do it either early in the day or late in the day, early evening. And the nice part about summer is that it's light a little bit later, so it's still relatively safe to go out for a walk or swimming if you have the opportunity to go swimming. Do something, you don't want to get too hot, you don't want to get too sweaty, but you want to get out and get moving during the cooler parts of the day.
One of the problems that occurs in any pregnancy as it gets further along, but can also be a serious warning sign, is ankle swelling when there's a difficulty. And what is normal as far as ankle swelling?
Okay.
And what can you expect to see? And also, what can you do to try and relieve the problem when it occurs?
Okay. Actually, it occurs, normal swelling occurs in about 75% of pregnancies. And what I mean by normal is just slight swelling of the feet and ankles. Okay. And it usually you start to notice it in the evening after you've been on your feet during the day. And usually it goes away overnight so that it's less in the morning. What would be abnormal would be if you noticed the swelling that didn't go away within 24 hours, also puffiness of your hands and feet. That would be a sign that you need to contact your healthcare provider.
I'm glad you mentioned that, because that's one thing I want to stress, that people should really take advantage of the fact that they can contact their healthcare provider, whether it's a nurse midwife, your physician. These people are there to help you, and no call at this stage is really a stupid call, because there are so many questions. It could just be based on what kind of medications to take or not take, what kind of fluids to drink or not drink.
That's right.
I want to get one more thing from you before we go to the break, and that would be, with this swelling and with the problems, what are the key warning signs that you have for people that they should call their doctor almost immediately, certain things that stand out to you?
Okay, if they have, all of a sudden they notice swelling in their hands and face, if they, of course, you're talking about any general danger signs?
Yeah, the key
any
ones are
kind of bleeding, any discharge that you think that's abnormal, especially if you think that your water broke, of course, you need to notify your physician right away. If you have severe headaches that don't go away with Tylenol, if you have vomiting, if you've noticed that the baby's not moving as much as it normally does, that's real important to notify your provider.
And all of these things can actually be linked and dealt with as far as heat and heat problems also, because the fact that you can get dehydrated, the baby may not move as well, the baby may be struggling, and once again, you need early attention. So if you're out there and you don't have a physician taking care of you, you don't have somebody advising you, this is what you need to do. You need to call and get help. And I don't care who you get, you need to get a health professional, because these things can be taken care of early, but each of our guests will tell you that if you wait too long, it can be a serious problem. We're going to be back with more of News Probe right after this. Welcome back to News Probe. We're talking with a group of experts here, and we're talking about issues related to summer, and you really can't talk much about the summer without talking about vacation and travel. And there are a lot of issues that we want to delve into. The first, and I guess the foremost, is safety. And if any of us travel in any situation, we're traveling in a car. Whether we're going to the airport or we're going to the beach, we're traveling in a car. What do you recommend as a pediatrician, Dr. Stemler, for safety in the car and for doing the best for your children, especially in those first few years of life?
Well, it's critically important for an infant to be in a car seat when they travel. Infants, being held in a parent's arms or in someone's arms, if you were to be in an accident, the infant just goes flying off into the windshield, into whatever is there. So that infant really needs to be in a car seat to protect it. And that goes for children up until the age of 4 to 6 years old, depending on how big your child is, when the child can actually safely be buckled up in a seatbelt.
So really, you want to get into those car seats, get into them early, and do whatever you can. Now, the availability of car seats is always an issue. Some people are given them when the child's born, and yet other people aren't. Is this something that's a state law, depending on where you are? How do you get a car seat?
Well, it's a state law in Pennsylvania to use a car seat for your infant and child. And in fact, I don't think that you can get out of the hospital these days without having an infant seat for your baby.
So they really
you
stress
actually have
that
to bring it in and show it to the people at the discharge.
I know one of the things we're always training our residents is we're telling them, make sure you tell the parents about car seats and about safety, because it is such an important issue and it can save lives. It's dramatic. Let's take it one step further. You're not just in the car, you're going to go onto an airplane and you're preparing for a big trip. What about that sort of a setting? Can a child, 1 month, 2 month olds, fly on a plane? And if they're going to, what do you do to protect them there?
Well, that's always a tricky question. The problem is if you put a child on a plane in a car seat or an infant carrier, you of course have to buy the seat ticket for the baby, which is expensive. Planes are actually, in that sense, much safer than automobiles. Your chance of having an accident, the way you think about it on a plane, are much lower than driving around in traffic.
So you really have to make a personal decision.
Right, you have to make a personal decision about that.
Tracy, you're a mother of 3, you're expecting a 4th. In your particular situation, what are the things you're looking at now when you try to travel? And what are some of the problems? Because you can probably tell a lot of people who don't have 3 children about what the problems are that you face.
A lot of the problems when you do go with all your children in the car or whatever it may be, children tend to move around. They don't, all of them don't like to keep their seatbelts on these, and it's important for them to keep their seatbelts on, because when you are driving, and I do drive, kids tend to stand up. They want to stand up, they want to move around, and when you have a baby, you have to keep the baby in the car seat, keep the seat belts on the kids, and make sure that they're sitting down, because they like to jump around and then they get to fighting, and it's very important for them to keep their seat belts on.
We're talking about issues of child and parent safety, and especially for pregnant mothers, those issues as part of our year-long commitment, Baby Your Baby, where we're trying and prevent problems before they occur. And I think that is the key all across the board here. Prevention is the key when it comes to good health with children. One more thing as far as traveling, and it's hard really to put, I'd say, a way to exactly say what the problem is, but when you go to your relative's house to drop off the children, whether it's the grandparents, a friend, somebody like that, that seems to be a place where there can be problems and confusion and difficulties, whether it's not child-proofed and those sorts of things. How do you tell your patients or suggest to them to tangibly and nicely say to grandparents and to relatives that the house isn't safe and to make changes?
It depends on the relationship and how often that child is going to go to the house. If you have a family where the child is going to be visiting frequently, or a household that the child's going to be visiting frequently, I think the parents may feel much more right to ask people to make changes. And otherwise, you just have to remind grandparents who, with the best of intentions, sometimes forget how quickly an 18-month-old or a 2-year-old can get into something, how quickly young kids move. Remind them that anything that they really care about that's breakable should be put up and away, and to also remember to be vigilant about watching the children, what they're getting into. You can never make it as safe as home.
Are there specific things in a hotel that you need to ask for, things that you want to ask questions about, that you demand that are there?
Actually, never really thought about that.
That's because it's your first baby, right?
That's right.
Tracy, let's ask you. Yeah, when you go to a hotel, are there certain things that you want that are safe?
The only thing that I see in a hotel is that the plugs, because little children, like you said, 2 years old, 3 years old, they wonder, and they like to put things in plugs or plug things up in plugs. You can get the plug adapters for free at different places. You can buy them. They don't cost too much money.
A little safety cap.
Right,
just
take them with you, and then you can put them in, and when you leave, you can take them out and take them home with you.
Another pediatrician I spoke to once also made a nice suggestion, which is with those sliding doors. You have to be careful if you're on a higher floor that you make sure there's a brace there to protect. Right. And again, you can't anticipate every problem, but the point is if you're thinking in this direction, then the odds are you're going to reduce the problems a great bit just because you're trying to anticipate problems. We were talking a little earlier in News Probe, we were talking about swelling and problems related to that. And one thing we didn't touch on that I wanted to, Ann, is diet. what are certain things in the diet that can be a potential problem for a pregnant mother especially in these hot times of the year, and also further on in pregnancy when swelling's a bigger problem?
Well, during the hot weather, your appetite is you just don't feel like eating very much or even drinking. So sometimes it helps just to eat small meals, maybe 6 times a day rather than have 3 big meals. The other suggestion I would have is, of course, you should be drinking at least 8 to 10 glasses of fluid a day. You want to stay away from caffeine drinks like iced tea, which is a typical summer drink. Caffeine brings your metabolism up and makes you feel hotter, and also acts as a diuretic and can make you lose fluids as well as calcium, and can interfere with iron absorption. So it's real important to stick with juices, milk, and plain water. And the other thing is take advantage of the fresh produce that's available right now. Fresh fruits and vegetables. They're your best bet, really, in this hot weather.
Sure, those green leafy vegetables and fruits, the best way to get all sorts of vitamin support, and it can be helpful. Another problem that occurs during pregnancy is urinary tract infections. They're much more common in women during pregnancy, and they can really progress into a serious problem if it's not attacked early and if there isn't an opportunity to do that. So I think with urinary tract infections, that's another case where if you have problems with urination, problems with what's going on, and pain on urination, decreased flow, those sorts of things, you need to check with your doctor, and you have to deal with those issues as well.
And, going back to travel, you need to, when you have the urge, you need to stop and use the restroom, because that can make you more prone to urinary tract infections, too.
Great, a lot of good tips. We're going to come back with more of News Probe right after this. We're back on News Probe, and during the break, a really interesting point, I think an important one came up, and you brought it up, Tracy, about public transportation when you have a lot of children and when you're pregnant. Talk to us a little bit about it.
Well, it's best when you do have children and you have a baby, because babies are small and you can't move around the way you want to if you don't have a baby in your arms, is when you do have children with you on public transportation, it's best to stay all together. Some people may tend to put one kid here, one kid there. It's best to keep them all with you, keep them all seated around you, so when you do have to get off the bus, you can all come together, whether it be a bus or you're traveling on Greyhound, or however that may be. You can all move together and you don't have to look around for your children. And like I said, children tend to move around a lot, so it's best to keep them all with you. Because if they're not around you, they're going to take advantage.
I think a lot of times you get different health experts together, but it's the person who deals with these problems day after day that really knows the answer. Dr. Stemler, you're embarking on having a baby. You're now worried about the issues of not only childbirth, but those first few months. My concern, and a lot of parents' concern in those first few months, is proper nutrition, things that children should be eating. What sort of advice do you have for young mothers about making sure they get the adequate calories?
Well, the most important, I guess, getting the adequate calories isn't the biggest issue for an infant. I think one thing that I do want to emphasize is that breastfeeding is actually a great way to feed a baby, and something that is very healthy for a baby, both in terms of helping their immune system as well as giving good calories. As long as the baby's drinking enough to pee 4 or 6 times a day, good wet diapers, that's enough that's going in. But you also do want to be sure that what they're taking in is either breast milk or infant formula. Babies don't need water. They're getting water in the formula, they're getting water in the breast milk. If it makes you feel better to give the baby a little bit of water every day, that's fine. But you have to remember that a baby's kidneys aren't very smart, and they can't get rid of too much water the way that adults can. And so babies can run into problems if you're giving them too much water.
Another good point is that program called WIC, which is available throughout our viewing audience, is a program that provides free formula, and it gets you an opportunity to get that formula for children as well. As Dr. Stemler said, I think the best thing is breastfeeding if possible, because of protective effects it has for your immune system, and because it's really nature's milk. But these formulas can be very good and very helpful, and they provide a lot of the necessary nutrients. Another issue this time of year, and we'll talk with you, Ann, about it, is sun exposure and young babies, and the fact that it's a very dangerous time because they burn quickly.
Yes, definitely. And so you need to use, it's important to use a good sunblock for babies, because they do burn quickly.
One of the things I found, and again, we could talk to you about it too, Tracy, is I found with my children is in a short period of time, too, they can burn even with the sunblock. You think you have the block there, but you may have missed a spot, you may have missed an area, and it can be a problem.
Some people think that, well, the less clothes you wear, the better you feel. But sometimes if you keep a layer of clothing over the baby, if you're going to have the baby out in the sun, then that's better so the baby don't get burnt, or you just don't take the baby in the sun to the extent where the baby is going to get burnt.
We're in a unique position here because we're able to talk and really help out a lot of people with health information. And while I have you here, we only have a couple minutes left, I'd like to ask each of you what is the most important thing that you think you want to share with an audience like this as far as health care and issues. And we'll start with you, Dr. Stemler, from a pediatrician standpoint. What do you think is the most important thing this time of year or in the early months of childhood that you want to share with people?
Well, touching on what Tracy just said, for babies in the summertime, dress them lightly. They don't need a lot of clothes. Clothes are to make mommy happy. The baby needs to get rid of heat. Give them plenty to drink, and keep them in a cool place if you can.
Anne, are there certain things that you want to touch on or an issue that you think is very important?
Well, just drinking lots of fluids can't be stressed enough, maintaining a good diet, and keeping in close contact with your healthcare provider and keeping regular appointments.
Tracy?
I would say the same thing. Drinking lots of fluids, make sure the baby's well kept, and keeping the baby in a cool place. And if you don't have to go out in the heat, then it's best not to. Because just like us as grown-ups, the babies get miserable also from being in the heat.
And I guess if I had to bring up something, I think the key thing is to make sure you stay in touch with your healthcare provider, that you do everything you can to give your baby the best opportunity, one, to be born in a healthy environment, and two, once delivered, to have a healthy environment. Be very careful this time of year. If you don't have air conditioning, be careful of places like attics where children might normally have a nice air during a cool period of time, but in these hot summer months, it can really be a death trap. That's a key issue. Do all you can, but ask for help. I think that's the most important thing. I want to thank our guests for joining us on News Probe and helping out with all your information.
Thanks.
Thanks.